The holidays are a time for family, travel, and celebration, but they can also bring an uptick in respiratory illnesses. That's the flu, RSV, COVID-19. Dr. Jessica Ford-Davis, pediatric hospitalist with OSF Healthcare Children's Hospital, joins us now with more. Good morning, Dr. Ford-Davis.
Good morning. Thank you for having me.
Now, first up, why do we tend to see more respiratory illnesses around this time of year?
Well, the holidays are a time for all of us to spend time together. That includes indoors, also traveling a little bit more, and really long hours and close contact with friends and family. And although that's great for connection, that can be really hard in a great environment for respiratory illnesses to spread.
Yeah, that does make sense. Same reason you might come down with flu after going to a business conference.
You got it.
Now, what are some of the main bugs that we see going around right now?
Right now, we see a lot of viruses, and before we would just say, oh, you have a common cold, but technology has really advanced, so now we're able to say what specific virus people have. So right now, we're seeing influenza or flu, respiratory syncytial virus or RSV, also rhinoenterovirus, and parainfluenza virus, which are a lot of big names, but essentially they're all causing common colds, but can also lead to other things like asthma attacks, pneumonia, bronchiolitis, and other illnesses.
So it's something that we all think we can really deal with, but there are chances perhaps for complications, and that's why we need to look after our health, yeah?
Correct.
Now, what are your top tips for keeping families healthy during holiday gatherings and holiday travel?
So a lot of it is very simple. First is washing your hands, making sure you have really good hand hygiene. So that's washing your hands, using hand sanitizer, also making sure that you're covering your sneezes and your coughs. And it's never too early to start to teach kids how to cover their coughs. Also the simple things like making sure that you're hydrated, getting a good night's sleep, and a really good balanced nutritious diet. Also reminding people that vaccines are wonderful. It can keep you from getting an illness, or if you do get it, you just don't get it as severe. So that can be getting the flu vaccine, updated COVID vaccines, and protecting yourself against RSV. And another big thing is making sure that we keep kids home when they are sick. And I know nobody wants to miss the fun holiday activities, but it's really important for them to stay home, make sure that they rest their bodies, but also not going and sharing all of that great respiratory bugs with their friends and family.
Yeah, I remember back in 2021, I think it was, my family had to adjust the entire Christmas gathering because my brother came down with COVID-19.
And it's okay to alter your plans.
Now, who is normally severely affected by these kinds of viruses?
Yeah, so kids are very resilient, and most of the time, if they do get sick, they're going to recover relatively quickly. But for those that are 6 months and under, they are at higher risk, as well as kids that have chronic or complex medical diseases, asthma, heart disease, diabetes, and even kids that don't have a great immune system, like kids that have cancer or undergoing chemotherapy, as well as the other end of the spectrum, including the elderly.
And real quick, what's your advice for broadly staying healthy through the winter?
So little steps go a really long way. And so again, just really good personal hand hygiene, making sure that you're staying home if you're ill, and then trying to do all the small steps, hydration, good sleep, and also knowing when you need to seek medical care. And just know that Children's Hospital of Illinois, all of us there are happy to take care of your kids if they do come down with something.
Thank you so much for joining us on the program, Dr. Ford-Davis. We'll share this entire interview on our website. Another half hour of 25 News is just a few minutes away.